Hi, this is Brian Kim, and I'd like to share with you a Hypermature Cataract with posterior plate case and my technique on how to get clear corneas with low CDE, high efficiency, and high safety with this surgery, and this is with a different type of technique. So this is a picture of the cataract. It's a pretty dense one. And this is a fact. Most all cataract surgery techniques work well for routine cases. But sometimes, despite our best efforts to compartmentalize, ultrasound can lead to corneal damage and edema, and vacuum can cause damage to the iris or posterior capsule. So that means high ultrasound and high vacuum at the wrong place and at the wrong time can potentially cause complications. And so high ultrasound near the cornea can cause edema, and high vacuum near the posterior capsule can cause rupture. So by minimizing these two things, cataract surgery is and would be inherently safer. So how do we do this? Well, there's two components of cataract surgery: lens disassembly and removal. For sculpting, you use continuous ultrasound to divide and then crack the lens. For traditional chopping, you use continuous vacuum to hold, grab and hold, and chop the lens. Traditional techniques require grabbing and holding the fragments with high vacuum and then emulsifying. So this means that traditional cataract surgery is dependent on ultrasound and vacuum. And so I call this a phaco-driven technique, where the sculpting and chopping require ultrasound and vacuum for a lot of the component steps. My technique I call a phaco-assist, where you're using mechanical forces to break down the cataract more and using the phaco and vacuum to help remove the lens pieces. And by doing so, I really believe this will help enhance surgery. So lens disassembly is broken down into double chop, cross chop to disassemble the lens, and using mechanical forces to sandwich the pieces between the chopper and the phaco tip. And you can do this because you're placing the instruments very deep near that posterior plate to fracture, and you don't use ultrasound or vacuum during these steps. During removal, you continue to use mechanical manipulation to bring the fragments towards your phaco tip, and then you don't use vacuum to grab the fragments, and you just pulse with ultrasound and vacuum to emulsify the pieces. So what's so special? The hypermature cataract with the posterior plate is the most challenging scenario. Deep sculpting near the posterior capsule is potentially dangerous. And traditional chopping requires burying the phaco tip on the top of the lens and then holding it with high vacuum. And holding the lens from the top and chopping from the top, whether horizontal or vertical, will not chop deep enough. In contrast, mechanical chopping techniques are more effective because of deep chopping. So let me just show you an example. This is the first double chop where I get the instruments around the lens and I chop it in half. You can see that there is still a posterior plate, but that's fine. And then you chop the cross chop, and you get now 3 fragments. Now here, sometimes with other techniques, you would try to grab that fragment with the phaco using ultrasound and vacuum, and that's what I meant by phaco-driven. Whereas with this technique, you're always trying to use the chopper to bring the pieces towards the middle. And by using the chopper to use this and bring the fragments towards you, this to me, I believe, is safer because you're not using ultrasound or vacuum near the posterior capsule during these maneuvers. And so that's the first point, is you want to use the chopper to bring these fragments towards the middle rather than grabbing it with ultrasound and vacuum. And I see this all too often on a lot of surgeons doing cataract surgery and using that phaco and vacuum to grab pieces. And again, in most cases, it's not that big of a deal, but in some cases it is. So here you can see I'm doing a sideways chop right there. That's a sideways chop where I got the chopper down and I'm holding it a little bit sideways, and then I'm using forces from the side tangentially with the phaco tip, and I'm mashing the instruments together to break that fragment. And I did that because that will help break that deep attachment of the lens because of this posterior plate. Because this lens is like a flower petal or one of those blooming onions you get at one of those restaurants, those fried blooming onions. They're all connected to the bottom. And it's very important to be able to use mechanical forces to get at that deep piece. So here again, you see I'm going the sideways chop right there, using the chopper, holding it sideways, and also placing that phaco tip deep and sandwiching. And so again, that goes back to what I was saying before. Because you're not using vacuum or ultrasound, you're able to place that phaco tip deep, and you're essentially using it as a chopper to really access the deep posterior plate. And by doing it this way, you really increase your efficiency, because you're not going to be inefficiently moving around trying to figure out how to navigate around this lens when you're able to access the problem directly. And I think it's because with traditional techniques, we've been trained to use the phaco tip for a lot of the very important steps. We're trained to grab the lens fragments with vacuum and then using ultrasound. And we're used to grabbing things with the phaco tip. And I think this is really not a good principle. Again, you saw that deep chop right there, because it teaches that we need to do a lot of the manipulation with the phaco tip. And I think if you're using fluidics, there is always a chance that you're going to do something wrong. And that has been certainly my experience. And so by doing it this way, I've noticed that I've had a lot less complications. Not to say that the complication rate is high, but especially with these challenging cases where there's not much cortex or epinucleus, when you're doing these maneuvers, if you're using a really high vacuum and high ultrasound, and you're taking a lot of effort to break that cataract using the phaco technology, you can run into trouble and you can break the bag. Whereas with this technique, it's pretty much unheard of, because you're using mechanical forces. So again, you place that chopper deep, and you can place, and you're doing almost like a diagonal chop there. You're placing that phaco tip deep also to get at the fixation point on the posterior plate there. And you can see that in the disassembly of this lens, you're able to use the chopper to really manipulate those fragments, and then sandwiching the pieces together in order to be able to make the pieces smaller, and then gently pulsing with the ultrasound. And you can see the CDE is not very high doing this. And so, again, you're using the chopper to do most of the work. You can place that phaco tip deep, and by doing so, you're able to use that mechanical leverage without using a lot of the phaco technology, which can be harmful and cause inadvertent damage. So again, here's that sideways chop that I was telling you about. Go deep and then fracture that fragment. Again, before with traditional techniques, you would try to do that indirectly by holding it from the top and trying to chop the best you can. But it doesn't really make sense if the point of that you're trying to break is deep, and you're doing all the maneuvering from the top. It just really doesn't make any sense. And so you can get to the point where you're trying to break the two pieces, which is deep at that posterior plate, using mechanical forces, and you can have complete confidence that nothing bad is going to happen, even though you have the phaco tip deep, because you're not activating ultrasound or vacuum. And that's really the key. Using the chopper to do all of the work, breaking things up, using your phaco tip as a secondary chopper. So you see how deep that phaco tip is, but that's perfectly fine. And I'm doing it again. I'm going deeper, getting at that posterior plate, deeper, deeper, and I'm just gently dissecting deeper. And that's really the key component. And then once you have that fragment, you want to use, again, sandwiching forces, just mechanically sandwich the pieces just like here, and then gently pulse the ultrasound and vacuum to emulsify. You can see those bubbles that are on the surface, on the endothelial surface there. This is a very, very dense lens, and I haven't caused any of the viscoelastic coating the cornea to come off. And that's again because of the way I'm doing the cataract surgery. I'm using minimal fluidics, minimal ultrasound, minimal vacuum, and most of the action is at the iris plane. And so you're able to have clear corneas because you're not removing viscoelastic, you're minimizing your CDE, and you're mechanically breaking up this very dense lens. And by doing that, you're also minimizing the vacuum. And so during this last component of the cataract surgery, where if you have any post-occlusion surge, the posterior capsule can fly up and you might damage it. But post-occlusion surge only occurs when you're using really high vacuum. And you're doing a phaco-driven technique where you're really trying to buzz, and eat that piece just using phaco. Well, if you're doing what I'm doing and you're breaking it mechanically and then you're gently pulsing the ultrasound and vacuum, it's a lot less likely to break the capsule or to have a post-occlusion surge. And so you see these very last fragments. There's, again, not much cortex or epinucleus at all. Actually, there's none. And that's the end of the case. So again, I'm hoping that to show you just a different way of doing cataract surgery. It's not a phaco-driven technique, it's a phaco-assisted technique, and you're using mechanical forces, deep placement of the chopper and the phaco tip to be able to get to the lens fragments, sandwiching techniques, lens manipulation with the chopper, minimizing ultrasound and vacuum. I'm convinced that this approach will give you clearer corneas, more efficiency, and safer surgery. Thank you for your attention.